cold and the wet. But right now we welcome Sam Creekmore. He's a member, of course, of the Mississippi House of Representatives, represents District 14, which includes Union County, serves as the chairman of Public Health and Human Services. Mr. Chairman, thanks for coming in. Good to see you, sir.
Always glad to be on. Thank you, Gerard.
Well, it didn't feel like this session was as active as last session in the sphere of public health, because last year, of course, a very contentious debate over expanding Medicaid in the state of Mississippi. Where do we stand on that?
Well, on the Medicaid, it's kind of on hold.
Okay.
With the new administration going in, the Trump administration.
Yeah.
And there's a lot of talk about Medicaid being cut.
Yep.
So the House of Representatives is kind of on a holding pattern. We got the code sections alive. If something was to break free, that we could adjust.
Okay.
But right now, we're waiting to see.
Yeah, I actually think that's wise, because there's mixed signals coming out of Washington, and it appears that they're getting closer to some sort of budget package that would come out of the House at this point. The Senate has one. They didn't really touch any of that. But the House is looking to make significant cuts to the program.
That's right. And, we're fortunate we have Drew, who was our former Medicaid director, now in the Trump administration.
Yep.
So we can call on him, and many other members do. So we're getting some insight from Drew Snyder.
Okay.
So that helps.
Well, until, though, they get the thumbs ups to pass legislation, you just don't know.
Yeah, just don't know. And you've been well part of the process last year with Medicaid in the legislature. We appreciate that effort.
Well, I appreciate you including me. It's just to maybe provide some information to guide you guys more than anything else is the way I see I can provide a role. What else is going on? Because we've got the scope of practice legislation that's also very contentious, been going on a while. It feels like we just keep rehashing the same stuff.
Well, and that's true. And legislators have scope fatigue. And so we were hoping this year maybe to get something passed through, which we did in the House. And it's not a complete bill yet. There's still some more input that needs to happen. But we were able to get it through, and hopefully some other people can come to the table and help us craft this thing as it goes along the way.
Well,
I'm going to tell you, healthcare in Mississippi we're not doing a great job. I mean, not that the people in the profession aren't doing a great job. We just don't have enough. And to me, this is an access to care issue. The number of doctors we have in the state have declined since 2019. And what we're talking about is mid-level providers. And that's defined as a healthcare professional that's not a doctor or a DO.
Okay.
And so we're talking about that mid-level, and you go in for a cold or a flu, and that's who you're going to see is a nurse practitioner, most likely.
Yeah.
And so that's we're trying to get those people more accessible to the people in Mississippi, especially in the rural areas.
And isn't it true, Representative Creekmore, we have lots of so-called healthcare deserts in our state where folks would have to drive a pretty long way to find certain medical providers.
Absolutely, and that's a real issue. And nurse practitioners the whole program was designed in 1965 in Colorado with the purpose of putting healthcare in rural areas. So that's why the program was developed by a doctor and a nurse, and so it's kind of evolved since then, as has a physician's role. The evolution of physician has gone from more of the general practice to more specialties. There aren't many doctors that are graduating from UMMC that are going into general practice. We only have I think it's 2,007 in the state of Mississippi, and my father's one of those. But more and more when you go in for a checkup, you're seeing a nurse practitioner.
Yeah.
And so if we can kind of free them up to be more accessible, I think it would help the people of Mississippi.
Okay. Do we have some legislation that would expand the scope?
House Bill 849 is that vehicle, and it has passed the House and is in Chairman Bryan's committee, and he and I had a discussion about it this morning. Yet a brief discussion, but we did have the talk, and so he's weighing the options on it right now.
Okay. Do you have a feel for that? Because I actually attended. I don't remember the bill they were taking up in the Health Committee in the Senate, but is that in the old Supreme Court room there, whatever it is? I can't remember the number, but I walked in and it's how it's configured, and you got all the doctors on one side and all the nurses on the other.
That was the AA bill.
Okay.
Anesthesiology assistant
That's
bill.
right.
And the
That's
CRNAs were on
That's
one
right.
side, and the anesthesiologist. And it kind of went south from there. Yeah. That is part of 849, though,
Okay.
that we did. So that part is still alive, too. We have a serious anesthesiologist provider shortage in the state of Mississippi and across our country.
Wow.
So that could possibly provide some relief by freeing up CRNAs, doing away with their collaborative, and creating the AA licensure.
Has there ever been any thought or legislation proposed, and maybe we have something I'm just not familiar with, to incentivize these specialists, these medical providers, to locate in the unserved areas?
That's a good point, and that's something we added to this bill. The Rural Physicians Program currently at UMMC is at 62 doctors, so their education's paid for, provided they go to a rural area for, I think it's 5 years. And so we increased that number in 849 to 100. So that would help provide some relief and get doctors to rural areas where they have to stay for a certain amount of time.
Okay. And this is a nationwide problem. It's not unique to the state of Mississippi whatsoever. All right. Well, what else you guys worked on that committee?
Well, a certificate of need bill we passed, and that since Republicans have been in the supermajority, nothing's been done with a certificate of need, and here's a real opportunity to get something done. And so we're opening up dialysis where hospitals can provide. They already provide inpatient dialysis, but they can't do outpatient. So this would change that, where they could do outpatient. Psychiatry and substance abuse clinics, it takes a CON away from that, so they can set up shop without having to apply for a CON, and it also increased the capital expenditures. If you're a hospital and you wanted to put a new parking lot in, you had to apply for a CON if it went over a certain limit. So we doubled that limit to bring it up to current really budget standards here in Mississippi.
What's your sense of where the Senate stands on this?
I think we're in a good spot. Again, that was another conversation I had with Chairman Bryan, and he was very open to it. And these are common sense, low hanging fruit initiatives that we're looking at doing with the certificate of need. As a capitalist and businessman, these make sense to me.
Yeah, it's just chipping away at it.
Yeah,
honestly.
Exactly.
Have you received some pushback? I know you have. I mean, there's some strong feelings about that.
Absolutely. People in your business or my business, if I was part of a CON, I would not want to be taken out because it would eliminate any competition.
It's protection.
So yeah, we've had some pushback, but the majority of people that have been common sense, and we're not for it, but we're not going to be against it because we know it can provide better health care for people.
Yeah. Well, we got to do something about providing some medical service and coverage to these unserved areas. It's a huge problem in our state. We have a fairly large geographic area state, and 3 million people are widely dispersed across.
That's right. And if you look at the maps, the physicians and the healthcare professionals are located in the metropolitan areas, and I get it. I mean, that's where the people are. It's where the money is. The money is.
Be honest. Especially if you're in areas where you've got a large number of uninsured or underinsured, or Medicaid, which reimburses at a lower level.
That's right.
All that's a problem. And speaking of which, talking about what the federal government, how they may act in reforming Medicaid to try to cut spending, I saw that there's also a possibility of adjusting what we passed a couple of years ago, right? The governor spearheaded the Medicaid payment reform process.
Right. And that's worked fairly well. I mean, the hospitals are really in much better shape than they have been. But that could be adjusted, which is a concern, real concern. And
so we're talking about, just so folks know, we're not talking about adjustments based on expanding Medicaid. We're talking about the possibility of federal dollars flowing into Mississippi, decreasing for our existing base standard Medicaid program.
Yeah, that they count on, they budget for right now. So that could be very significant.
And if we don't pay our match share, then we don't get the federal money, and that's about $7 billion a year, last I checked.
Substantial.
Right. If you can hang around, we keep talking. We got Representative Sam Creekmore from the Mississippi House of Representatives is in the Element Wealth studio. Representative Sam Creekmore is our guest. So the arguably the highest profile legislation that is meandering its way around the Capitol right now is tax reform. You're certainly aware of that.
I am.
House Bill 1, labeled dustly because it is the Speaker's top priority for sure. And I think he's communicated that to the caucus, to the members there. It passed handily in the Mississippi House. It's been transmitted to the Senate. The Senate, on the other hand, just passed their version of a competing tax reform bill yesterday. It made it out of committee last week and then to the floor. It passed, had, I think, 4 Republicans who voted against it, joining Democrats. What do you think is going to happen there? What are your thoughts?
You know, I think we can reach a compromise. You know, obviously, Speaker White, as you mentioned, it is top priority and evident by the first week of session, we bring it out and roll it out and get it done and send it over to the Senate immediately.
Yeah.
And so, and the way committees have been going since kind of the second half has started, everything's kind of slowed down until we see what happens with HB 1 or the Senate's proposal. I think there's room for a compromise. And I like the House bill because it addresses more than just income tax. And so the grocery tax is important to both sides. PERS is important. And this is a plan we have that will eliminate income tax over time.
Yeah.
The Senate bill does not.
Right. It stops short, terminates at 2.99% in 2030, whereas the House bill phases it all the way out by 2037.
And there's room for adjustments, but I think it's important to have that master plan out there. This is our goal at the end.
Okay.
This is what we're trying to achieve. And so I applaud the House for having that out there and putting it out there early.
What's been the reaction from your constituents?
Some of the retirees are concerned.
Sure.
The younger people, not so much. They like the idea of not having the income tax. So that it's been mixed, but it really by age.
Okay. And I think that's the same analysis I would make as far as our text line and just in the public in general, social media. That's what I've seen. It's mixed.
And I've had local leaders concerned too. They're worried about city taxes and all going up, or property taxes, which that's not part of this bill.
Yeah, and I wonder because the House bill actually would provide more dollars to them. The 1.5% local option that they'd have to opt out of.
Right.
Is more than they currently receive from the sales tax diversion of 18.5%.
Yeah, New Albany, where I'm from, I think would gain $675,000.
Okay. Well, that's significant,
so that's significant
to a town the size of New Albany.
That's right.
They can do a lot with that money, big time. Yeah, and then the counties participate
that's right.
Under this bill in sales tax revenue.
And I think the supervisors are for it. I mean, from what I've heard, the input they've given me, they like the bill.
It'd be hard to imagine they wouldn't be because this is a new pot of revenue they don't currently have.
That's right. And they don't have enough money as it is, so this definitely helps.
Yeah. And we should point out, I don't know if you had a chance to review the article I wrote that analyzed the legislation, and I've got a chart in there where I compare the various categories of taxes in Mississippi to the neighboring states. And Chairman Lamar's pointed this out numerous times. Mm-hmm. Even if we went to 8.5%, sales tax, general sales tax, we're still lower than all the neighboring states.
Absolutely. We're very fortunate in Mississippi to have such low taxes, and even raising them. And although this is kind of you're doing away with income, so you're raising over here, but it was still positive for us compared to everybody else.
Yeah. Well, I've made that point numerous times, Representative Creekmore, that it's hard to cut taxes in Mississippi because we already have fairly low taxes.
Very low. And it's hard to provide the services, just like public health or schools, by cutting taxes and not raising it somewhere else or having another income source.
Yeah, that's absolutely true because while the state did increase pay for teachers, now we're seeing the other states have reacted and now we're falling behind again.
That's right. And the other thing, which I didn't point out earlier, but we address roads and bridges with the House bill, which I think is extremely important. We've never had a consistent income source other than the federal government for our roads and bridges in the state of Mississippi.
Executive Director of MDOT, Brad White, has made that point, as you well know, countless times.
Yeah.
Has he not? That we're losing out on access to some federal funds because we can't show the federal government, in accordance with all their rules and guidelines, that we have sufficient state matching dollars to pull down that money, right?
For maintenance, just general maintenance.
For basic maintenance.
And so that's important, and he's doing a great job in making each lawmaker aware of the needs we have.
Yeah. Well, any thoughts about the House choosing to increase revenue to be dedicated to roads and bridges on fuel purchases as a sales tax as opposed to increasing the excise tax? Something we hear a lot.
Yeah, it is, and the sales tax is on top of the excise tax.
Right.
So the excise tax,
it's on the total purchase.
That's right. So a little heartburn from that, but at the end of the day, that we got to have the maintenance, and that may be something we can negotiate out, that it's not on top of the excise tax. It's set the excise tax aside. But for the greater good of Mississippi and Mississippi roads and bridges, I think it's important that we get this done and give MDOT a revenue stream, just like we talked about with healthcare, that they can depend on.
They made it very clear that we're losing out on federal funds to do that. Yeah. But as you know, if you're a retired person, this isn't terribly popular because they don't get any benefit from ending the income tax because they don't pay income tax now. So
That's
they got a heck of a deal right now.
But the retired people I talk to, is like, this is your gift to the next generation, to your children and grandchildren and great-grandchildren.
And former Speaker of the House, Philip Gunn, always did a great job of pointing that out as well.
He did.
Justification.
And that's the other thing. This is not just something we've come up with in the past 2 years. I mean, we've been working on income tax for several years, since I've been in the legislature.
Honestly, the first bill we had in 22.
Yeah,
I thought it was the best one we've had yet, well, and I know it was pushed. What do you think?
Yeah, I thought it was great too. I mean, it was, and we've got it through the House. So it's half the legislators are doing this and are for it.
Yeah, well, we'll see where all this goes. The ballot initiative is something else that I hear a lot about in the public. I don't know if you hear that so much from your constituents, but of course you know the story there. We don't have one, even though the Constitution says we're supposed to.
And I would like to have a ballot initiative. I think it's important just for the whole process of how bills are made and laws are formed. And, we have so many people want to put things on the ballot. Well, you can't bring this subject up or you can't bring this subject up. I would just be for a ballot initiative based on the number of signatures that you got to have and what the number is, percentage that you got to get it passed by. Okay.
Well, Constitution Chairman Price Wallace had a bill teed up and basically announced a couple of weeks ago it just doesn't look like this thing's going anywhere. We're not even going to put it on the floor.
Right. Well, and I think there hadn't been a lot of public interest in it. There's been some.
Interesting.
But we're not being contacted a lot by that. Not that that's a reason not to do it.
Yeah.
But the other thing is there's been so many special interests that, let's not have abortion on there. Let's not have marijuana part of this. And if this is what the people want and you can get the signatures and the votes, then that's kind of where I am.
Okay. Mobile sports betting. Another crack at that.
Well, we have it here already.
That's right. We just ain't getting any money from it.
Mississippi legislature's not getting any money from it. And I don't get it. That's another one the House passed out last year, died on the Senate, and here again we've done the same thing. Yeah. So it's over on the Senate side to see what they can do with it. We need it. It needs to happen, and it's another revenue. We're cutting taxes, so here's a income source for the state.
Yeah, I think Representative Casey Urey, who sponsored this legislation, estimated $25 million in revenue to the state, and there's formula for how to allocate that. I think it'd probably be more than that, and I say that because North Carolina just did that last year, and it just absolutely exceeded all expectations by a long shot.
Yeah, and it's sitting out there ready to go. We just got to get it passed.
We got to get Senator David Blunt, who heads a gaming committee over there in the Senate, to sign off on that thing,
He
get it
may
on the
do it.
floor. I hope so.
I saw him this morning. I'll talk to him.
I hope so. Appreciate you coming in. Thanks
Always
a lot.
glad to do it. Thank you for having me.
Thank you. Representative Sam Creekmore. He represents District 14, Union County. He's chairman of Public Health and Human Services. We're coming right back in the Element Wealth studio.